Hello, my name is Zainaba Ali, and this is on Health Leader Evaluation. This presentation evaluates healthcare leadership using two models, National Center for Healthcare Leadership and GE Healthcare Performance Solutions. Today we'll explore how these models assess leaderships, their metrics, and their practical applications throughout this presentation. The need for leadership evaluation. Healthcare organizations rely strongly on leadership to drive performance, ensure patient satisfaction, and achieve strategic goals. According to the NCHL, poor leadership contributes to high turnover and reduced organizational performances. This presentation explores leadership assessment in healthcare, a critical factor for organization effectiveness. According to Harris et al. 2020, effective leadership directly correlates with improved patient care, staff engagement, and financial efficiencies. Leaders must be assessed using models to ensure alignment with strategic goals. We'll compare two such models, the National Center for Healthcare Leadership and GE Healthcare Performance Solutions. Overview of the two models. The two models we'll explore offer different yet complementary ways to evaluate leadership. The NCHL focuses on leadership competencies, helping organizations cultivate talent through behavioral assessments, while the GE Health Performance model uses performance metrics and Lean Six Sigma methodology to improve clinical and operational outcomes, tying leadership directly to data-driven results. The NCHL competency model categorizes 26 leadership competencies into three domains: transformation, execution, and people. This model supports leadership development by focusing on behaviors such as innovation, accountability, strategic orientation, and emotional intelligence. It is commonly used in 360-degree reviews and succession planning, as stated by Harris et al. 2020. It also helps organizations identify and develop high potential leaders in a structured way. This model also emphasizes leadership through measurable performance and behavioral standards. GE Healthcare Performance Solution Model. GE Healthcare Performance Solution applies business intelligence and operational tools to measure leadership and process performance. It also applies the Lean Six Sigma principle using advanced data analytics and benchmarking to evaluate how leadership decisions impact clinical and operational outcomes. Leaders are assessed on how well they drive measurable improvements, such as reduced patient wait times, increased throughput, or cost reductions, which are all essential to high reliability healthcare. Capturing metrics in GE Healthcare. Key metrics include the cost per patient, clinical outcomes, and adverse event rates, employee and patient satisfaction scores, as well as real-time dashboards and analytics that facilitate decision-making. Comparison of the two models. While the NCHL model zeroes in on the how of leadership, like communication, integrity, strategy, the GE model evaluates the what, such as how leadership affects throughput, cost, and clinical performances. Both are very valuable. NCHL nurtures effective behaviors, while the GE model ensures those behaviors result in a measurable improvement for the organization. Comparing the models, the table. So looking at the NCHL competency model, the focus of this model was the leadership competencies, while for the GE model, operational outcome and performances was the main focus. As far as the data type, NCHL used behavioral assessments to look into the data, while the GE model used quantitative analytics such as measurements and the application of talent for the NCHL competency, while GE used a system-wide performance alignment. And the NCHL competency model would be ideal for the use in mid and senior level leaders, while the GE model should be used in like executive and systemic leadership. Which model is most appropriate? The choice depends on the organization's strategic goals. For internal leadership development, NCHL is ideal, but for aligning clinical, financial, and operating goals, GE Healthcare excels. A hybrid approach may be most effective for comprehensive leadership evaluation. While looking at both models, they both have value depending on the goal. NCHL is best when developing people and aligning leadership behaviors with culture and mission. The GE model is ideal when assessing leadership by measurable outcomes like reducing wait times, improving patient throughput. Ideally, an organization uses both, developing people while also measuring the results that they drive, as stated by McClarney, 2008. Recommendations. The NCHL can be used for personal and cultural alignments, while the GE healthcare model can be used for strategic and performance-based evaluation. With integrating behavior and data, this can help with recalibrating based on the changing goals. I recommend a dual approach for this model. For the NCHL, to help leaders grow emotionally and culturally, and for the GE healthcare model to ensure that leadership is also delivering performance. As Morrison 2020 notes, leadership must be agile and accountable, and assessment models should evolve alongside healthcare's shifting priorities. In conclusion, the NCHL and GE Healthcare Performance Solution models offer distinct but complementary lenses for evaluating healthcare leadership. One emphasizes who leaders are, while the other is what they achieve. Together, they help healthcare systems ensure that leadership is both compassionate and effective. Effective leadership assessments support strategic alignment, talent development, and improved patient outcomes. Leveraging tools from both these models can help in the organizations. Thank you.